Hi, this is Derek Mahoney, and today I'd like to discuss with you what I do as an orthodontist in children who are in a primary dentition. Now, people might say, why is an orthodontist getting involved in primary dentition? Because during primary dentition, we get a lot of facial growth and certain habits need to be eliminated. For instance, for a 5-year-old who has a crossbite due to posture like this, we can eliminate that postural shift by doing build-ups on the teeth, and that's called the Planas technique. And this brochure, which I'm happy to send to anyone who maybe can't attend the lecture but wants more information, explains about the Planas technique. And the lady who's going to be speaking about that is one of my previous students. She's a doctor from Brazil, and her name is Dr. Alina. So that'll be a great topic on what to do with crossbites and also functional shifts anteriorly, so your class 3 or pseudo class 3 patients. Then we're going to discuss the Myo brace, which is a fantastic appliance. In particular, we're going to look at the Myo brace for juniors, and we're going to discuss how's the best way to get a good outcome with these. I'll discuss not just how they work and which appliance to use, how do you motivate a child to wear it? What things would prevent them wearing it, such as inability to breathe through the nose, such as a tongue tie or a lip tie, etc., etc. So in that regard, we have a speech pathologist who is also dual qualified as an oral myologist talking, and that will be Nada, and then the developer of the Myo brace himself, Chris Farrell, will be giving a guest lecture, and that's really important because Chris has the most experience than anyone else in the world on this particular product, which is revolutionary for what it can offer for a small price for a large population, but compliance is what it's all about. We'll have an ear, nose and throat doctor who'll be talking about allergies. It's very common in these children, so it's a big program, and I think it's very good for any general dentist, whether they're going to incorporate full comprehensive orthodontic treatment in their practice or not, to understand what to do with young kids. All day long I see general dentists deal with 4-year-olds to 6 and 7-year-olds with nothing more than fissure sealants and oral hygiene instruction, right? And if they really need a filling. But what's happening? These kids are not sleeping well, developing a facial pattern where the jaw is narrow because the tongue not doing its job. So if you want any of these brochures or any information on the Myo brace, feel free to send me an email. I'm happy to share that information at no charge so that the child gets better and we prevent problems from developing year by year. So I'll see you then.